Okay.
All right.
All right.
We're live. Look at us. And it's Monday morning, and I'm super, super excited because here we have Dr. Frank Longo, who is a genius, a legend in the space of Alzheimer's and the brain from Stanford, and really lucky that he came down here to Los Angeles. Not for us, but we're piggybacking on a Stanford event that he did, and it's always it's an honor to meet him because I've heard so much about him, and as I've traveled the world talking about Alzheimer's, the brain, and neurological differences, and everybody has said to me, you must meet Dr. Frank Longo because he's doing so much interesting work. And we're going to talk about the pill that was discussed, that's his, that was on the cover of Time magazine a while ago. And I know Dr. Frank Longo now because of my friend Lily, who made this connection for us. Lily Sarafan is our partner with Move for Minds and the Women's Alzheimer's Association, a great collaborator, a woman entrepreneur who started Home Care Assistance, and she's going to make an announcement about our partnership for caregivers today. So I want to welcome both of them so much, and the connection really between those who have Alzheimer's and those who are caring for those with Alzheimer's and other forms of dementia. But I wanted to start with you, Dr. Longo, to tell us what you find to be so exciting in this space right now.
Well, right now, it's exciting that the field is opening up in terms of our understanding of the brain and age events that happen in the brain, that I think our approaches to prevent Alzheimer's and to treat it are really increasing in a good way. You know, over the years, we've been focused on amyloid, the substance that accumulates in the brain and is toxic to the brain. And I think those approaches remain important. I think amyloid's important. However, there are a number of other events that occur as we age, and particularly those of us who get Alzheimer's, and we're having a better understanding of those. So I think we'll see a greater diversity of therapeutic approaches that will be much more likely to lead to successful prevention or treatment. So that's what I'm most excited about.
So the idea that people who sit at home think, one, you know, that Alzheimer's is a natural form of aging, which we're always saying it's not. But two, that people think, like, they hear about every trial that's failed, they think that there's no hope, it's just hopeless, and that there's nothing they can do about their brain health.
Right.
How would you dispute that? What would you like to say, why that's wrong?
I would say over recent years, our understanding of Alzheimer's and aging has become much deeper, so that the trials that are in early stages now, I think, are much more powerful, and I think are more likely to be successful. In addition, we're treating at earlier stages of the disease, and we can detect it earlier. So if we put all those things together, earlier detection, treating at the right time, more powerful approaches, some combined approaches, I think we'll have a much greater chance of having an impact.
You said there's some exciting things that might be going on about what young people can teach us about how we age.
Yes, well, several of my colleagues at Stanford have been interested in whether or not that young people have biologic factors that might protect the brain from degeneration. And so they have done studies initially in mice with Alzheimer's, where they take young blood plasma initially from mice and give that plasma to aged mice with Alzheimer's, and the connections in the brain came back that are lost with Alzheimer's disease. And the mouse memory function got better. So very exciting at the mouse level. And recently at Stanford, we've started a trial where we're collecting plasma from young people, blood plasma from young people, and giving it to people with Alzheimer's disease. And that trial is still underway. We don't have results yet, but that's an example of really jumping on aging mechanisms and opening up a new avenue of treatment. So the big mystery now is, what is it in that young blood that's preventing degeneration in the brain? And my colleagues at Stanford are really narrowing down to a few possibilities of what's in that young blood, and that so someday we don't have to treat with young blood plasma, but we can treat with those proteins that are in the young blood plasma.
So super exciting. And Lily, you know, we were just talking about the millions and millions of people who end up as caregivers for those with Alzheimer's and other dementias, something like 15 million in this space alone. But I read a statistics not too long ago that said 3 out of 5 Americans will actually end up as caregivers. We also know that 2/3 of those caregivers now are women. What are you seeing, kind of what I call on the front lines, with caregivers, how they're doing, what they need, how they can be supported?
Absolutely. Well, I'm so happy to be here. I feel like I'm sitting between two titans of influence. I have this healthy
I like that
obsession
word,
with
titans of influence.
women's healthcare and advocacy and neurology, so I feel like I need plasma infusions from both of you. So HCA, home care assistants, we hear from hundreds of thousands of families every year across the United States, and typically we're receiving the phone call from the family caregiver. And I think a lot of folks may not know that 25% of adults in this country are serving as family caregivers. They're spending 20 hours a week or more caring for an aging loved one, and on average, they're working full-time and have their own kids. And so I think the best thing that we can do as a society in caring for the caregiver is to recognize the enormous burdens that we're placing on women as the primary caregivers, the primary decision makers for healthcare in their family, and unfortunately the ones who are suffering from Alzheimer's in larger numbers.
So what do those caregivers, those that you speak about that are working full-time, that are parenting, that are caregiving and caretaking, what do they need from you, from us?
So I think what they typically need is some respite. Dr. Longo has been such a leading voice on what everyone can do to help prevent the development of dementias in our aging years, and unfortunately those who are caring for an aging loved ones are the least likely to take advantage of some of that advice and guidance on nutrition, on sleep, on physical exercise. And so what we can do as an organization is to provide the care and the peace of mind to families so they can attend to all of their other obligations. And I'm also really excited to share the partnership.
We have a big announcement, drum roll.
Drum roll for the big announcement that
Okay.
Home Care Assistants and Move for Minds and the Women's Alzheimer's Movement have partnered to provide that type of respite to family caregivers. And essentially what we're saying is that, it's really rewarding but also challenging to care for an aging loved one.
Yeah, emotionally, physically, spiritually.
Physically, it's causing, also lost productivity and retention issues for companies.
So how does somebody get a respite grant from you through the Women's Alzheimer's Move for Minds? If they're sitting at home, they're caring for a parent, they need like a minute, they need some time, they're feeling completely stressed out themselves, how do they apply?
So they go to homecareassistance.com/moveforminds, and there they can nominate themselves or someone else to receive a weekend of respite where we will step in and take care of everything for the aging loved one, and they can attend to their own health to make sure that they're taking advantage of all we know about healthy aging.
That is so incredible. And talk about a titan of influence. This is the beginning of where we need to go, which is bringing companies, corporate America, people who are on the front lines together with doctors, together with movements to really say our population has changed dramatically, right, in this country, and people are suffering from brain-related issues and or need support.
It is quite a challenge. We notice in our memory disorder clinic the demand for our services is going up at an astronomical rate. Our clinic and clinics all over the United States now are having trouble meeting the care demands of people that are having cognitive difficulties, and we worry about our families. So it's an entire ecosystem. We have our patients, our families, we working as healthcare providers. It's all one big ecosystem,
right? And
so we worry about each other.
Yeah. So I want to ask you, Dr. Longo, because when this Time magazine cover came out, the Alzheimer's pill. It was a big bestseller, right? And everybody ran to thinking, oh my God, there's a pill I can take and I'm not going to get Alzheimer's. It's your pill.
Right.
What's the status of it now a year later?
So we're excited about this medication that we've been developing.
C-130?
Yes, it's called LM11A-31.
31, okay.
C31 for short.
Okay.
31. Good
31.
Good memory.
Yeah, that's right. I was looking through there, I was like, okay, it sounds like something out of Star Wars. But
good memory. And so the reason why we developed it, because we believe that several powerful factors cause Alzheimer's. The accumulation of amyloid, the accumulation of the tau protein, and mechanisms related to aging and inflammation. All of these conspire together to, in a very powerful way, unfortunately, cause the brain to degenerate. So we developed a strategy that would treat all of these mechanisms together rather than just focusing on amyloid or just focusing on tau. And that's what this medication has done at the mouse level. So we're very excited to have been able to move it into human testing.
And you're doing it now in Europe in 3 countries, right? Austria, Germany.
So the trial phase 2 will be done in Europe. So phase 1 was in normal people for safety, and fortunately that was successful. It proved safe in phase 1. And then phase 2 is in our first Alzheimer's patients in Europe, and that's correct, in Austria, the Czech Republic, and Germany. Okay. We can move a little bit faster in Europe. Our trial does require 2 spinal taps for each patient, and the patients in Europe are a little bit more accustomed to getting spinal taps, interestingly. So we can go a little bit faster and a little bit less expensive in Europe.
So how long will that take?
Each patient will be treated for 6 months. We will enroll a total of 180 patients. It'll take about 2 to 3 years to finish the trial to have the final results.
And then there's phase 3.
Exactly. So if we get some favorable trends in a phase 2, then we'll move on to a phase 3, and hopefully the phase 3 will be in the U.S. as well as Europe.
So we just heard this morning that Alzheimer's got an additional $400 million in funding in the budget in Washington to try to understand this disease. So many people on the front lines that I met who are up in Washington were caregivers saying, this couldn't come a minute too soon, right? That they're, just maxed out, stressed out. What do you, when you talk to these caregivers, what do they say to you other than the respite care that they want to know from doctors like Dr. Longo?
I think that we're living in an era where data and evidence-based approaches are really important, and it's an exciting time because we can actually measure what's going on. And I think what all family caregivers are looking for are for every player in the ecosystem to be doing significant measurement and science. It goes without saying that a leading neurologist like Dr. Longo is using data and science every day in his work. But I think a lot of the providers, like home care assistants, sometimes it may not be so obvious how much of a role we can play in understanding when someone goes to the physician once a year or a few times a year, or they go into the hospital once or twice a year, we know what's going on there. Often what happens in the home the other 360 plus days a year is a black box.
One of the things in Washington when I was testifying was the trying to focus on an educated caregiving workforce, that so many people, one, really don't value the role of caregiver. It's not paid well. Oftentimes people don't know the difference between someone with Alzheimer's and cerebral palsy or Parkinson's or special needs. What are you doing to make sure your workforce is educated and ready?
So first of all, we have an 8-book series all around healthy longevity that our tens of thousands of employees as well as the broader consumer public are welcome to review, where we're going into the science behind cognitive decline, but also the lifestyle guidance around caregiving. Also, we have our own online university for all of our caregivers. This is something that's accessible to our employees and in a sort of limited fashion available to the public as well, where we're doing training and guidance on disease-specific care plans so that it's not generic care that we're providing, but something that's really personalized to the specific attributes, condition, and prognosis of the clients we're serving.
That was one of the big challenges I found when my father was diagnosed, finding a caregiver who understood what Alzheimer's was, understanding what they could or couldn't do with him.
Right.
Do you find that you still meet a lot of people, or you even who come into the clinic, who are uneducated about this disease?
I mean, it tends to be that no one wants to think about any of these topics until a moment of need, until the diagnosis comes, until mom is, unfortunately found wandering, until the keys have to be taken away. And so unfortunately we haven't created a societal acceptance around some of these topics so that we can talk about them. I think the work you're doing is brilliant because it's elevating and heightening people's awareness and education around these, but it's absolutely the case that the vast majority of times that we're getting contacted by an adult son or daughter, it's because they haven't figured out how to navigate this really complex situation. They have a parent leaving the hospital and they don't know what to do at home to ensure quality of life and positive clinical outcomes.
Yeah, I think Lily has a really good point, Dr. Longo. You were saying that you're seeing more and more people come in.
Right.
Is that because we're getting older as a population, or do you think there's something environmental that's happening so that people are experiencing more cognitive issues?
I think it's a little bit of both. I think primarily it's we're getting older. The demographics, I think, as our healthcare system does somewhat better with cardiac disease and cancer. I mean, we have a ways to go in cancer and cardiac disease, of course, but we're seeing our waiting room now is filled with healthy 70 or people in their 70s and 80s who are fairly fit, but their cognition is not. And we're seeing that pattern more and more. So it's
But why would that be? Because everybody tells you exercise, exercise, so you get fit, but...
Well, by fit, I mean they're okay in the heart and cancer and other things. But I think the exercise remains very important. And in fact, for years, doctors have been saying exercise is good for you. And what I'm excited about is Lily mentioned the importance of data. I think in the past 5 years or so, we have enough high-quality exercise studies have come out that we have real data now on how powerful exercise is. So we get asked all the time, well, my mother exercised, but she still got Alzheimer's.
Yeah.
My feeling is, well, she probably got it 5 or 10 years later because she was exercising. So I think exercise does delay onset of this.
One of the big things that move for minds is trying to stress is, as you were just saying, the fact that exercise is needed. We have to look at the diet, we have to look at sleep, we have to look at caregiving, we look at meditation, we look at social interaction. And that's really the space that we've been trying to say. So if you're in one of the 8 cities that Move for Minds is occurring, I hope you will sign up, because you give us 3 hours, we're going to change your life. We're going to tell you everything you need to know about your cognitive health, your physical health, right? And what you can do for yourself and for somebody you love to get out there. Do people, is there really things that you can do that increase your cognitive health, whether you're a caregiver or someone who's in their 60s or 70s?
Yes, I'm a great believer in that, and I think your program is a fantastic example of that. As I mentioned, we have great data for exercise now. People can get modest levels, 4 or 5 days a week, 30 minutes a day or 2 times 15 minutes, quite flexible.
Right.
That has a very powerful biologic impact. I think exercise has probably the largest effect, but remaining cognitively engaged, I call it cognitive engagement, especially with a purpose. So engaging with other people, an individual being on some kind of mission where they're using engagement.
Yes.
I think the computer-based brain training might be helpful. It's a little bit more of a controversial area, but there I worry about we're not on a mission as much on doing the games. I think having a mission, maybe, for example, working with some of the programs you're doing, right? That's a cognitive mission, right? And I think the so-called Mediterranean diet, the studies continue to come out there. If we compare the Mediterranean diet with the Western diet, I think the Mediterranean type of diet, not in extreme forms of diet, but the diets that hopefully many of us can do to some extent at least, reduce progression or risk for dementia. I think what's important, and I think what your program really points to, the combination of these things. There's no one, the holistic approach, and we have a number of trials going on in Europe now. One based in Finland is furthest along. They're putting everything together: the exercise, the cognitive engagement, the diet, and they're seeing effects in reducing the number of people that get dementia. So it's the programs that promote the holistic approach are critical.
So Lily, do you find though that people are interested in the information, the holistic approach for their loved one, their parent, and then they're eating sugar, drinking, not exercising, working 20 hours a day?
Yeah, unfortunately, that tends to be the case. There's something very real called caregiver burnout. So you can imagine if you're attending to your full-time job and your kids and spending 20 hours a week on an aging loved one, the sad irony is that they're spending so much time and energy providing the best of care for their parent, but not necessarily for themselves. And so I think it is really important to take that holistic approach. And what we've found is that when we're starting to introduce our personalized programs into the home, so we have a cognitive therapeutics program, we have something called the balanced care method, we have our own sort of cooking program, is the family caregivers begin to get engaged and said, well, these are things that I should keep in mind for myself. And so we're hoping, our mission is to change the way the world ages. Our hope is that we're creating a paradigm shift, not just for the 86-year-old who is the prototypic HCA client, but also all of their kids and in-laws who can take advantage of this guidance.
When you say your mission at Home Care Assistance is to change the way the world ages, I speak to so many people who are in their 40s, 50s, 60s, like myself, who say, my mom or dad says to me, they can't remember this, they can't remember that, and I tell them it's just stress. And is that kind of to protect ourselves? What's the best advice you have for someone who thinks it's just stress?
That's always a challenging question, because starting at age 30, all of us develop what we call age-related memory impairment, believe it or not.
At age 30?
Yes. That's where our short-term memory function starts to slow just a little bit. Hopefully.
OMG. If you're 30, we're here to help you. Okay.
And so the common question in a clinic like ours at Stanford is our typical person in their 60s, for example, is having a little bit of noticeable change in short-term memory. Is this normal or not? And typically, we'll do some testing to try to sort that out. And then the rules of thumb, is it affecting day-to-day function, for example? Just to guide us to know whether this is significant or not. But it remains a difficult challenge. I think ultimately our ability, this is where the better brain scanning comes in. Can we look deeper in the brain and really...
Isn't that really expensive for people to do?
Now it is,
Yeah.
I mean, your insurance won't pay for it at
So
this
what do you
point.
do? You're out there, okay, let's just say you're 40, your mom is 65
Right.
or 70, she's forgetting, or your dad,
Right.
and
I would go to a physician just to get a basic checkup, to not miss anything easy. For
okay,
example,
so I've talked to a lot of people who go to their regular physician and they go, don't worry about
well,
it.
no,
there's
I often, unfortunately, one needs to go to a neurologist or
Okay.
a geriatric physician who has an interest in cognitive health.
Okay,
right?
that's really important point that Dr. Longo just said. If you are concerned about your parent or yourself, go to a neurologist or someone who's focused on healthy aging. This is
Yes.
a kind of burgeoning space as well.
It is. And so our job is to really look for some of the easier things to address. For example, you could have a low thyroid level, and that could affect memory. Well, we would hate to miss that, right? Because we could
Okay.
treat that. One could have a low vitamin B12 level. That can
Right.
affect memory. We don't want to miss that, right? So we'll do what's called a screening, looking for these other things. And so typically, and we'll do some memory testing. Now, if the memory testing is within a reasonable range, we can't find these other things, then we say, maybe this is just stress, or you need to exercise, take care of yourself. We'll see you once a year, but try not to worry about it. And I think once people find that they've had an initial assessment, we've added some structure to their lives, we've added a plan how to deal with it, I think they do much better after that.
So at Home Care Assistance, Lily, are you looking for people to become caregivers? This is a space where people, seems to be an expanding space.
It is. I mean, the 85 and up population is the most rapidly growing segment of the U.S. population, which means that the potential of a caregiver shortage is very real.
Right.
We have significant vetting of our employees, and so it's not for everyone, but someone who is looking to become a professional caregiver, we have 160 locations throughout 40 states that are always taking applications.
So people say to me a lot, like, I just can't afford. I can't afford a caregiver. I'm working, my husband's working. I can't afford to put my mom or dad in one of these, quote, fancy homes. Like, what is somebody to do?
Well, the first thing they should do is to apply for a family respite grant.
Yay, that was a good
Because that will be absolutely free and provided as a gift from Move for Minds and Home Care Assistance, and so that's number one. Number two, education is free, and so while someone may not be able to take advantage of all of the solutions and services and products that are available or coming down the pike, what they can do is ensure that their lifestyle is accommodating the healthiest outcomes. What I always found really inspirational, and Dr. Longo speaks about this all around the world, is that our genes are not our destiny.
Right.
I found it really empowering to do my genetic testing. It's not for everyone.
Now, this is a big,
Yeah.
huge space that
Right.
just came out, 23andMe having a
Right.
test for Alzheimer's. The
Right.
Alzheimer's Association said they don't advocate this. What do you say
Right,
about
good
that?
question. So 23andMe relisted the high-risk gene for Alzheimer's. It's called the ApoE gene. One can get that done now. We generally don't recommend it in most cases for our patients, because we worry about, once people find out that they have a high-risk gene, it can be stressful,
Yeah.
and they can't go back. They're stuck knowing that. And the other question is, what do we do about that?
Right, that's
And
the key.
and you could say, well, exercise more, I'll be on a healthy diet. Well, we probably should be doing that anyway. So if we had a drug that would address this high-risk gene, then it would be worth getting tested. Probably we're not quite there yet. So we generally don't recommend it.
But as Lily was just saying, your genes are not your destiny. You were just saying, even if you have the APO4 gene, that doesn't mean you're going to get it.
It doesn't mean you'll get Alzheimer's for sure. It just increases risk. But Lily's mentioning a study that I like to talk about, where when one has the high-risk ApoE gene, the amyloid accumulates in the brain at slightly higher rates. But when they looked at people that have that high-risk gene, but the ones that exercise are able to not have that amyloid accumulation, it's as if they canceled the effect of the gene by exercising. So exercise isn't everything, but it shows that we can influence what our genes are doing.
So one of the big questions that I ask and are always asking is why women seem to be getting Alzheimer's and cognitive impairment at such a high rate compared to men. And I always say it's not because we live longer. That's something that I used to hear all the time when I traveled around, and finally now I'm hearing, no, we're looking at other things. We're looking at chromosomes. We're looking at how inflammation is processed by women. We're looking at depression. We're looking at what goes on, stress, hormones. What do you think it is?
Yeah, I think it's a combination of these factors. We're lucky at Stanford. We have two of the leaders looking at mechanisms of why women are more vulnerable to Alzheimer's. We were just talking about the ApoE high-risk gene.
Right.
That risk is much more powerful in women than it is in men. And one of our faculty at Stanford really brought this out and has done quite a bit of work on that, Dr. Mike Rachis. We have another faculty member, Victor Henderson, who's really looked at the hormonal issues. And he was one of the leaders of the Women's Health Initiative that really figured out that maybe giving everybody estrogen wasn't necessarily a good thing to do.
So, but that big study confused women, I think, more than ever.
It did.
So women don't know, should they take hormones? Should they take bioidentical hormones? When do they take it? Some people tell you that estrogen is good for your brain health. Others tell you it's going to increase your risk for cancer,
of course.
Right, so what is...
Yeah, we don't have the final answer yet. I think Victor and his colleagues on that study really showed that it's not a one-size-fits-all, that not every woman who's postmenopausal should necessarily be on estrogen supplements, because that's what doctors were doing at one point. And I think this study led to the fact that for some people, dementia rates were even going higher, right? So I think now that the field is developing, trying to figure out which specific groups of women might benefit from estrogen replacement postmenopausally, but certainly not all women necessarily. And are there some better approaches than the estrogen replacements? And we don't have the final answers yet. And I think one needs to tailor it again by working with a physician who has an interest in cognitive health, because then they keep up with that area. No final answer yet. But I think, going back to Lily's program that provides a structure for caregivers, I can't tell you the positive impact we can have on families that come to our clinic that have a source for structure in their lives. Because they come to a physician now, and unfortunately, as physicians, we say, there's no treatment that works for this disease. There's no way to slow it down. There's no way to prevent it. And that's it. That's all we traditionally give our patients and families, and they go home with that, and that's devastating. And they have this emptiness of how to deal with this. Getting to your questions, and I find that when we give them a plan of attack, at least, let's do these strategies. Let's check on this. We're in this together. We still haven't offered a cure, but they come back to me saying things are better. Even though we can't cure it, things are better. And I think Lily's program can do this in an even more powerful way than a physician working alone.
So giving people strategies for their physical health and their cognitive health. First, telling people that they're connected. Surprisingly, so often, as you say, someone will come in physically fit and not cognitively fit. Exactly. So beginning that conversation with people is really important. Giving them a break, That's super important. What else if someone's listening?
I think that there's also a really important role that companies can play in this. Sometimes we put all of the emphasis on the individual, on the family caregiver who's already dealing with a lot of stress, which leads to inflammation, which leads to all the issues we're talking about. And I think that, right now we're living in a time where companies are placing significant emphasis on childcare, but not so much on elder care. Companies have benefits around childcare. There's a national conversation around childcare, but recognizing that if companies also offered that structure in addition to some of these individual components, that would really be beneficial. That means creating education and awareness programs for their employees. That means offering progressive, sophisticated benefits for elder care the same way they do for child care. That would tackle the majority of the adult population in the United States, and then they would be getting that support from both their employer and from their physicians, providers, and everyone else in the ecosystem.
We were just, when I said I was in Washington testifying a couple weeks ago and went over to AARP and talked to them about, they just implemented a caregiving leave program where you could, you know, go in if you're taking care of a parent or an in-law, or and actually get leave time. And do you see that as something that that companies will begin to think is smart business?
I hope so, because we again, with our patient population, their family members, their children are bringing them to the clinic, and they're taking time off of work to do that, right? So I think it'd be a tremendous attraction to recruit great people.
Yeah, there's $50 billion of lost productivity right now from elder care. And so imagine how companies, it would be smart business if they could reduce turnover, increase and improve retention, especially of their women leaders, which is a huge priority across the private sector right now. So it's a win-win for everyone.
Well, I want to thank you so much, both of you, for coming, for making time. I'm so honored to be partnering with Home Care Assistance. If you want to apply for one of the grants, you can go to homecareassistance.com/move4minds.
Yes.
Dr. Longo will bring us more up to date about what happens with C31 and all of the exciting research going on at Stanford. I think the biggest difference you can make today is perhaps to go and join us at Move for Minds. All the money that we raise online will go to women-based research, 100% of it. And if you don't live in one of the 8 cities, you can support someone who is going to the events in one of those 8 cities. If you're a company, send your employees, because they'll get educated, their lives will change, they'll learn about brain health. Never before have this many experts in all these different spaces come together in all these cities. So we're really trying to get corporate America involved. We're trying to get people of all ages. As you said, Dr. Longo, we start to experience brain health issues at 30. So come in if you're in your 20s, learn about it, because I get so much information from my own kids who are in their 20s about sugar content in juices and what's good and what's not good to eat. And I think this is really something where we can bring generations together.
Yes.
That's right.
Which is why we talk about it as the ultimate women's empowerment movement, because I say if you don't have your mind, you have nothing. And women find themselves, and that's not sexist, that's just smart, to look at funding research where the majority of the cases are, because that research will benefit men and women, as I always say.
It will.
Have we left anything out?
No, I think this was terrific.
No,
Yeah.
this is, thank you for all of these programs are so helpful to our patients and families. And it's the research and these programs together that will make a big difference.
Exactly. So if you're available for a clinical trial, join that. If you run a company, think about a caregiving leave process. If you are concerned about your parents, please take them to a neurologist or somebody that's focused on healthy aging. And this is, as I have said and they have said, a really exploding space. And sign up for moveforminds.org. Do it now. I'll give you a pair of Beats or something. I'll do something, anything. Just please come. Thank you, Dr. Longo. Thank you.
Thank you.
Thank you
Lily.
so much. A real
Great.
privilege. Thank you.
Thank
Have a
you.
great week, everybody.